Today we're going to present you with the self-help that you can have if you suffer from an anterior spondylo listhesis of the cervical.
Anterior spondylo
Listhesis.
Anterior cervical spondylolisthesis. It's a barbaric name. You probably have not heard of this unless you have this condition. So what exactly is that?
So spondylo basically means vertebrae, listhesis means displacement, and anterior. So we're talking about the anterior displacement of a vertebrae in the cervical spine. Believe it or not, it's not an uncommon phenomenon. And listhesis in general are present, according to certain studies, in up to 10% of the population. So many people have that, and Dr. Cody, how a patient will know that he has that?
You'll have to see a specialist, whether that be a chiropractor, physical therapist, medical doctor. But the gold standard is getting an x-ray, and a lateral view of the x-ray will really show the angle, the curvature of your cervical spine, and there should be a natural curve there, and everything should fall in line with that. But if one segment is pushed forward, that's the anterior spondylolisthesis.
And usually it will go very often with a severe protraction of the head. And people who have that protraction from a long time usually have that symptom associated with it. So once you know that you have a spondylolisthesis, there is a second thing that you need to know.
Yes, not only if you have it, but where. What exact level are we talking about that has this anterior displacement?
And if it's above the C5 level, then the exercise that we're going to show you will work, generally speaking, great. Now, it works great for a lot of people, but not all. So what is a secret mantra on this one, Dr. Cody?
Well, the thing is that when you do this, you should feel better and not having pain at the time, immediately afterwards. So your range of motion should increase without pain, and it should be better overall. But
And if it does not,
then you're going to stop.
so we repeat, if you do not feel better after that, you
Stop.
all right? So let's see the exercise. For this exercise, what you need a table, either a kitchen table, either your living room table, as long as it's at roughly that height, the height that you would normally eat, it will be fine. Then you need enough room to slide part of your body under that table. That's all what you need. Next, you need a towel. And we're going to wrap this towel, put it 2/4 on the table, the other quarter out, and we're going to have a mushy surface so you can press your forehead on it without hurting yourself. Now, how are you going to sit? You're going to sit around to have your head straight to your upper thorax at around 1 hand width away from the towel that you will have put on the edge of the table. Next, we're going to press. The whole motion is you're going to press your head in such a way to bring the upper block of cervical vertebrae posterior in relation to the lower block. But remember, vertebrae are attached by ligaments, and they have some motion, some translation motion. So you want to really focalize the force, the shearing force, to one specific area. And for that, you want to create a tension on the upper cervical. And how do you do that? You tuck your chin in. Tuck your chin in. Second, you're going to round your back. That's going to tense this. And then the flexion of the knee is going to also increase the tension on the back. So now you have a tension on the lower back, tension on the upper back, and you're going to grab both legs under the knee, and you're going to gently, not press with the head, but press with the upper body. You're going to press with the upper body in such a way to put pressure on your forehead to move that upper tensioning posterior a little bit. So go ahead, very good. And you're going to do that one time. 2 times. Every time you're going to stay in pressure for around 3 seconds. 1, 2, 3. And you stop. You're going to do that 4 or 5 times. Then you stop, and you're going to turn your head on the right, then on the left, then go down and up. Make sure you don't have any increase in pain. What you need to observe is an increase in head rotation, a decrease in tension of the head. And it may be small at the beginning, but if this result is positive, then you know that you can keep doing it. And that's where you should keep doing that for around 10 times, 10 reps. And then you test again, and then you're going to do 2 more sets of 10 reps. That's how it works. Now, there is some adaptation to that. If you see that it doesn't work as well as you want, you're going to move your lower back. So you move, that's it. You're going to keep the chin tucked in, and now you're going to increase the pressure. But here you're going to have a little bit more extension to your head by having moved your lower back forward. So usually I advise to move the lower back around 3 times to pick up the best distance of your body from the edge of the table. There is also a way to improve that shearing motion that using a belt, and I do not recommend that right away. We will have another video to explain it.